welcome back to Living East Tennessee. We have been talking about American Heart Month, and now we sit down with a doctor to answer all your heart-related questions. And joining me today to share more is Dr. Lori from Summit Medical Group. Welcome to the show. Of course, at this subject, we talked before the show, it's so incredibly important, especially for women.
It is.
Talk to me about American Heart Month and really details that women should know about this month in particular.
Sure. So American Heart Month is important. It's a great time to recognize how prevalent heart disease is in our country, and it's a good time to recognize what your risk factors are and how you can help manage those. So just some general statistics about heart disease. It is the #1 cause of death in our country, and it remains that way, and it has been for some time. It's estimated approximately 1 in 5 deaths can be attributed to heart disease directly, with up to about 80% of those generally regarded as being preventable. So.
Yeah, absolutely. And for women in particular, 1 in 3 women, is that correct? And there's so many changes our bodies go through, whether it's when we're teens to in our 50s. Talk about how that definitely has an impact in our heart health that men might not experience as well.
Right. There's a few differences between heart disease and women and men, both in the development and presentation. So women, typically the incidence of heart disease or the prevalence of heart disease does go up after menopause with those hormonal changes, along with many other things. In addition to, it's harder to recognize that in women. Women are more likely to present with atypical symptoms of heart disease compared to men. With men, we tend to think of that chest pressure, elephant sitting on your chest, you know, the pain radiating to your jaw, shoulder, or arm, shortness of breath. Women can present much more atypically. They can have 1 or 2 of those symptoms, not typically with the chest pressure. Sometimes it can just be jaw pain or shortness of breath. It can be very subtle in nature, and it makes it much more difficult to diagnose in women.
Hands down, I automatically always think something's wrong with me. Like if I have like a sudden pain, right? But if someone is out there and they're listening and they're like, I've had this pain before, different things along those lines, or I don't know if this runs in my family, what would you recommend for women out there?
Talk to your doctor. Heart disease, we know, can start years before you develop symptoms. I typically divide it up into modifiable and non-modifiable risk factors. So I think early on, even at our ages, before typically we see heart disease, things can be developing in your body that you're not aware of. So see your doctor at the very least once a year, get your blood pressure checked, cholesterol checked, and talk to them about your personal risk, whether it's family history or something else that may increase your risk. If you are having symptoms, don't dismiss them. Talk to your doctor about them and let them work you up for it.
That's incredible. Well, you're such a safe space and like trusted source. So where can people get in touch with you? And are you taking on new patients as well?
I am. I'm with Summit Medical, and I work out at Concord Medical Center out west. I have a special interest in preventative care, particularly cardiovascular health. So if you do want to establish with me, you can reach me. I believe our number is 865-691-0733. And I go by Dr. Lori, typically, because the last name's hard.
Hey, I love that. Well, thank you so much for just opening your heart and you know, and being able to be a voice for women. So I really appreciate you joining us today.
No problem. Thanks for having me.
Always, always. Alrighty, you guys, when we come back, we rejoin Julie Levin, and she's giving